Welcome to the Connection Podcast, presented by the Yuma Cares Coalition, where voices from prevention and mental health come together to inform, educate, and strengthen our community. Because connection is prevention.
Hello, everyone. Welcome back to the Connection Podcast. I'm Jenny LeGros from Yuma Cares Coalition. And I have here with me today, I'm so excited to have you here, Courtney. This is Courtney Starkey, Clinical Supervisor from Community Partners of Integrated Health. Welcome.
Thank you.
So lots to discuss today, especially because we had the privilege of having you present at our March Coalition meeting, which seems like forever ago, but then it was only a few weeks ago, right?
Yes.
So I want to ask you first, for those people that might not be familiar with you and your organization, what is your mission, the heart behind it, and tell us about the work that you're doing in the Yuma County community.
Sure, definitely. So Community Partners Integrated Healthcare, or CPIH, was founded in Tucson approximately 20 years ago. And we are a part of a greater family of healthcare providers. We're a part of Intermountain Centers. And under Intermountain Centers, there's also Behavior Consultation Services, Pinal Hispanic Council, I'm drawing a blank here, Family Service Agency outside of Phoenix, as well as more recently, Rio Salado Behavioral Health Systems. So with all of our agencies kind of together, and Intermountain being around for over 50 years, starting in Tucson, we are now throughout the entire state of Arizona. And here locally, we are both CPIH and Intermountain. So our Intermountain services are our foster care program. We have multiple homes licensed throughout Yuma County, as well as some therapeutic foster care homes. And we also have our BCS ABA program that does services in home, in school, and now slowly starting to move to providing services in office. CPIH is kind of typical of a health home that you would see in Yuma, so we are able to provide medical services. Within our medical center, because we are integrated, we have both primary care as well as psychiatric care. And then our outpatient services focus around case management, care coordination, family support, peer support, and then we have supportive counseling that our care coordinators are able to provide, as well as therapy with master's level therapists. And our specialized program are our substance use program, which utilizes the community reinforcement approach. So it's a little different than other programs here in Yuma. And then of course we have our amazing school-based mental health services. So that is one of my pride and joy, because I get to supervise all those amazing staff. And we are currently in 5 different districts now in Yuma County since we began 5 years ago. So basically we've added a district every single year. So maybe hopefully moving into the 6th we'll have another one.
Right.
Yes.
That is amazing. What growth.
Yes,
what
definitely.
growth. And lots of different things going on there. In fact, when you were just sharing that, I thought, I learned a lot at the previous presentation at the coalition meeting, but now I just learned just right now about some even more services that you provide.
Yes.
So since partnering with our coalition here in Yuma County, how have you seen this collaboration positively impact the students and families?
Well, I have to say, I've been providing services in Yuma for well over 20 years. And I've seen it ebb and flow a lot over the years. And definitely when COVID hit, we saw a lot of agencies kind of close their doors. A lot of people just kind of lost that connection to services. And being able to reconnect with the coalition, I see where we have kind of filled some of those gaps, where we have the opportunity to engage with one another more directly and talking about all the different services that are available within the community. It definitely helps with referral sources, looking at what's out there, and we're able to have that ongoing communication. So instead of people feeling like they have to kind of work in navigating multiple different agencies, we all come together from mental health, medical, law enforcement,
Right.
everybody in business communities. And now you have that research. You know what? I remember so-and-so from the meeting. Let's reach out to them and see what they can do for this member. So being able to really provide that consistent and collaborative care throughout Yuma County.
Right.
And of course I love, as we were talking earlier before we got started, when back in high school,
Right.
we were part of the grad night. That was some of the original grad nights that started, and to see that coming back, I think is amazing, and how the coalition is able to sponsor that and help get that going for our kids.
Yes, absolutely. And definitely the coalition is has made it easier to be able to do that, right? Just having everybody there at the table or at one spot in one meeting, being able to come together and support, you know, these events for our students.
Yes.
Let's go back really quick to about the school-based services, your pride and joy, like you were saying.
Yes.
And I know, you know, being a former school counselor, that was something that I know was a huge need in the schools. And so now, tell us what that a day or an example of what that really looks like when a student is able to receive services, school-based services.
So it looks a little different at every district, but kind of the foundation of it is the same. So like within the high schools, it usually starts off with them reaching out to the social workers on campus and talking about what kind of additional supports and helps that they need. And then the social worker will reach out to the family and talk about, hey, we have this agency that is available to provide these services for you. And then they move into, once the referral comes to us, we're doing the intake and then assigning them to the counselor that's assigned to that school. Within the elementary districts, they go to more kind of the school counselor there. And the same process goes along with that too, where they're able to offer the services to the family and then send us a referral and we start intake. Once the kiddos are enrolled, from there the counselors will either reach out directly to the teachers or to the social workers at the high school and reach out to the parents and talk about, this is who I am and this is what we're providing, and review those goals that they talked about during the intake and what that looks like individually for the students, if there's any additional supports that maybe they need as a family. And then they schedule to meet them on campus. And depending on the need, they may see them weekly or they may see them bi-weekly. Some of our kids, if there's not as many at the campus, sometimes they may see them twice a week. It just kind of depends on the situation that's going on.
And it's year round.
It's year round,
right?
yes.
It doesn't stop in the
It does
summer.
not stop. So during breaks, like we just finished up with spring break, so our counselors were able to, in some situations, provide a small group for the kiddos. So they had like at least 3 days throughout the spring break week where they met with the kids and took them out to the community and did some different activities with them. And then during the summer, we have more advanced program with that. And again, you know, more towards the elementary and middle school, they typically will work either on our side, or they'll go to the library, they'll go to the parks. They'll do some different activities with them, focusing around social emotional education, life skills. The high school, though, really focuses a lot on just the mental health services, social emotional, but a lot on life skills and helping them transition towards adulthood. So they do a lot of volunteering throughout the community. We've been at the food bank, Amberley's Place thrift store, as well as the Humane Society, volunteering there. They do a lot of projects as well, looking at job placement. They write resumes, right, you know, so that when they graduate, they're ready to move into the adult force.
Absolutely. And what just an amazing thing to just remove those barriers of scheduling and things like that. I know that for families that was always very difficult, and not wanting to take them out of school, you know, in order to receive these much needed services. So just removing that barrier is a huge thing.
Yes, and we will offer families if there are things that are more intensive, such as trauma. We don't necessarily want to take a child out of class, talk about trauma, and then send them back and expect them to get through their school day very well. So being able to then offer them, do you want to work on this outpatient wise? We can still come into the school and teach you some really good strategies to manage your school day and be able to be successful at school, but we can deal with the trauma outpatient. And a lot of families will do both.
Yeah, that's wonderful. That's wonderful. So let's talk about community efforts. So how has working alongside our coalition strengthened that mission locally, and what have you observed about the power of unified partnerships in prevention and community wellness?
One of the things, again, from working in this field for so many years is we get to the point where we're a little siloed. You know, we kind of work in our own realm and being able to do that. And again, I think COVID added to that a lot because we weren't able to meet as frequently as you might have been. Of course, working under the children's system of care, we have the child and family team, but even then sometimes it still feels very siloed because maybe you meet once every 6 months and that's all the real communication that's going on. That's something that is a huge goal for me, to be able to make sure that all these partners that we collaborate with in working with our children are there and we are all on the same page. And what I love about the coalition is that it has reduced some of that silo a little more. I always think about to this image that's part of the CFT training where it's basically like a school security guard is like hanging a kid out a window at an alternative school and says somebody will catch him, and down below you see all these cars pulling up, and they're all pulling up separately, and then immediately below the child with a safety net is a gang. And it talks about the gang is usually the ones that pick them up the most. And so when we get away from those silos and we have this open communication and we have these opportunities to come together and realize resources that are there in our community, we're coming all together in the same vehicle.
Wow, that is a really powerful example. And you are spot on about, like, if we don't come together, what the outcome could be. And we don't want it to be that negative impact that's being influential, especially on our students and our youth. So what else? What else is going on? I mean, amongst all of the things that you have within your organization, what else would you like to share with us?
Well, this month is a real big month for me. This is Counseling Awareness Month for April.
Wonderful. Of
course, last month, I roll my eyes at them because I'm a therapist and not a social worker, but last month was Social Work Awareness Month. Next month will be Mental Health Awareness Month. June is PTSD Awareness and Men's Mental Health Awareness Month, and then July is BIPOC, which is Black, Indigenous, and People of Color Mental Health Awareness Month. So all these months right in together really are focusing on helping to understand and overcome the stigma that exists around mental health. And no matter how much we have had positive conversations about mental health, the stigma is still there. And people still very much think that they are broken by having to come and receive mental health services. They think that they're sick, they're crazy, there's something wrong with them. And so that really puts a lot of barriers on seeking support and seeking that help. But the reality is none of that's true. They're not broken, they're growing. They're finding that opportunity to continue to become more self-sufficient, which is our mission, to provide those quality, innovative, and evidence-based services to help people reach their potential. And so I think most important that I would want people to know is that we're here. We're here to listen, we're here to provide that support, we're here to provide a place for you to breathe, and recognizing that you matter and your story matters, and whatever you bring to us, from something as small as everyday stressors to major life-changing crisis events, we're there for you. And we'll give you the tools and the strategies that you need to keep moving forward and continue to grow.
Wow, what a beautiful way to end. And it is so true, and everything that you were saying just reminded me of connection. And that's exactly what we're here talking about today, is connection. And so thank you for all that you do for our community. Thank you for sharing, and thank you for continuing, because we have a next few busy months, extra busy months in regards to bringing awareness to positive mental health.
Definitely.
So thank you.
Thank you.
And thank you all for listening. We hope you have a wonderful day and week, and weeks to come, actually, and listen in next time.
Thank you for joining us. You can find more information and resources on our website at ycadc.org. The Connection podcast is proudly sponsored by R.L. Jones Insurance.